Moving on now, Rongai. We now move on to a story in Samburu, where in August last year, we brought you the story of Elizabeth Nanguta, a woman from Barsaloi, Samburu, who was then an expectant mother. Now, Samburu is a county where most maternal and newborn health indicators are lower than the national average. We followed Elizabeth to know what happened since August and what the community stands to gain from a healthcare project initiated by 3 corporate bodies. Dorcas Wangira has that story.
There are places that sleep and wake up with sometimes little and sometimes no ambition. This is Barsaloi at the heart of Samburu, a desert that is both life and death, where one is released to focus only on what is essential. Elizabeth Nanguta lives here, and the first time we met her, there was a pulse of life 6 months in her womb. Her child was coming, and she hoped that she would give birth at the Barsaloi Health Center.
Unless you've walked a mile in a pregnant woman's shoes, you will never really understand how she feels. This road, laced with rocks and thorns in the very remote nerve of Barsaloi, is a silent witness to the journeys of many expectant women, some who walk for many kilometers just to get access to healthcare.
Her daughter and 4th child, Nayeku, came one evening in the first week of November.
I went to the clinic and didn't find a doctor. I came back home and gave birth. Took her to the clinic for an injection the same day.
When a woman gives birth at home, she can have many problems. What if a midwife touches infected blood? They should give birth in the hospital.
Samburu County still has some of the most grim statistics in maternal deaths. Many women here still die giving life, where maternal health care is not always the first option. For the longest time, health facilities were in poor condition at Suguta Marmar and Barsaloi, places long forgotten with no access to roads, insecure and plagued by extremely harsh weather. An upgrading venture driven by private and public partnership is giving new hope to expectant mothers and the entire community.
Barsaloi dispensary we first reported about pales in comparison to the Barsaloi dispensary that you can see now. A better facility that bears a greater promise to the children and the women in this community.
A comprehensive project will ensure that no mother dies whilst giving birth, and the children live to become healthy Kenyan adults.
Nayeku has not yet been baptized.
I want her to become a doctor. That's my dream for her.
If a child lives long enough, it may not really matter where he or she was born. Nayeku's story represents a village, a community that is coming to birth, whose transition is not immediate or completely perfect. But every day there are nuanced changes, steps closer to better healthcare, better options for expectant mothers, and every child that will be born here. Dorcas Wangira, KTN.